Hello, I'm Jordan Kenny and welcome to Coronavirus Catch Up. We're live on the BBC News NI website and Facebook page and on the BBC iPlayer for the next half hour or so. So thanks for tuning in, however you're joining us. It's been another busy week. As I'm sure you'll know by now, in 3 days' time, we're going back into lockdown for 2 weeks. Understandably, there's a lot of people with a lot of questions about this, lots of people wanting to know what kind of Christmas lies ahead. With me to give his take on it all, and most importantly, to answer those questions, is Northern Ireland's Chief Medical Officer, Dr. Michael McBride. Dr. McBride, how are you? Thanks for coming on.
Good evening, Jordan, and thank you for the invitation.
No problem. Dr. McBride, before we get into the questions from viewers, lots of us will know you or recognise your face from the briefings you've been taking part in at Stormont during the pandemic. But for anyone watching who maybe doesn't know you, could you briefly explain what your job is and what your role has been during the pandemic?
Okay, well, thank you for the question, Jordan. My name is Michael McBride. I'm the Chief Medical Officer for Northern Ireland, and my role and responsibilities are in the area of protecting the public from the new infections, but also providing advice to the public in terms of how to keep themselves healthy and well. Related policy areas around infectious diseases, disease prevention, health improvement, many government strategies that we have around drugs and alcohol and mental health and well-being, suicide prevention, and also to advise ministers here in the department, but right across government, on the steps that government should be taking to improve the health and well-being of the population. I've been doing the job for some 14 years, and I work very closely, and certainly even more closely over the last year, with my counterparts in England, Scotland, and Wales, as we work to have a united approach across these islands, including my colleague Tony Houlihan in the Republic of Ireland, to how we respond to the coronavirus.
Mm-hmm. Well, we'll get straight into it, Dr. McBride. Within the last hour, we've heard news about what Christmas is going to look like for us all. People in Northern Ireland and in other UK nations will be allowed to meet indoors in up to 3 households during a 5-day Christmas period, so from the 23rd to the 27th of December. Dr. McBride, what does that mean for students who are travelling home from university for Christmas? Do they count as a separate household to the rest of their family, in which case only one other house could join that bubble?
No, for students travelling home, that will be their household, so they will become a member of that household, so that then they can then combine with 2 other households. I think it's very important, the point around students travelling home. What we need to recognise, this virus isn't going away for Christmas, and we need to minimise the risk of us transmitting the virus as we travel home, whether that's students or anyone else. And we can do that by taking sensible steps before we come home for Christmas, and that's limiting our contacts before we travel, and being particularly mindful of older people at home who we may come in contact with, or those who are extremely clinically vulnerable because of underlying conditions. And in the 10-14 days before we travel, we can reduce that risk by reducing our own contacts. Now, for students, as you know, across the UK, there's been ongoing work to coordinate the travel of students and to ensure that students have tests using the new lateral flow devices, 2 tests within a 3 to 5 day period, so that they can be assured that as far as possible they're not carrying the coronavirus asymptomatically when they travel. And again, those are steps that Queen's University, UU, working together, are putting in place here for students in Northern Ireland who are travelling home to other parts of the UK, or indeed to other parts of Northern Ireland.
So should students be having COVID tests before they travel home then?
The Minister launched that programme at Queen's University at the Whittle Hall just this week. So those arrangements are in place for students to have tests, because we know that upwards of 50% of people can carry COVID asymptomatically, and particularly younger people who often don't get symptoms, and that's been one of the challenges in fighting this virus. So there will be communication to all students indicating the windows whereby they should come forward for a test, and they can be tested, and then they will have to have a repeat test, and then following that repeat test, then it will be safer for them to travel home.
And obviously, you were talking there about Queen's University. For students at different universities that maybe don't have access to this rapid testing, is that something they should still be pursuing, a test before they come home for Christmas?
Well, I mean, Queen's University was one of the three UK universities which led this work. We're fortunate that Queen's has quite considerable experience in some of these new testing technologies. They're different types of test from the PCR swab test that we know, and they can give rapid turnaround of results within some in the region of 60 to 90 minutes without laboratory facilities, and they're based on saliva samples, so they're less invasive. And Queen's has been working. One of the things we did with other universities, one of the things that we did as a department very early on was to set up our Northern Ireland laboratories, the Regional Virus Laboratory, or laboratories across all our trusts, working with the scientific and academic partnerships that included ALMAC, AFBI, other companies, and also other facilities that never actually processed infectious disease samples. And Queen's has been working very closely with the other universities to provide access. So, for instance, University of Ulster students on the Belfast campus can avail of the testing facility in the Queen's University, and there will be other arrangements for Magee and for Coleraine campus as well. So those arrangements will be rolled out for all students in Northern Ireland.
So moving on from the Christmas restrictions, there are a couple of differences to the lockdown this time around than the lockdown we had earlier in the year. As things stand, schools are set to remain open for this 2-week lockdown. What's your thoughts on this, Dr. McBride? Do you think schools should be closing early for Christmas?
Well, all of these things need to be weighed up in the balance. I mean, if you ask me what the greatest impact is in terms of suppressing the transmission of the virus and reducing R to as low as possible level, then that can be best achieved with the combination of hospitality and schools closed and all of the other things which we are now familiar with. However, we need to keep a balance in all of this. We need to recognise that children and young people have paid a very high price during this pandemic, putting their education and their lives, and indeed in some instances their livelihoods and jobs, on hold. And the education of our children is a priority, and so it should be. We also need to be aware that it's often those from the most socioeconomic deprived backgrounds that suffer most when actually they don't have access to education. That's important not just for education itself, but sometimes for the activities that go around school and the support that they get well in the school environment. So the executive quite appropriately has to weigh up all of the benefits in terms of reducing the risk of transmission of the virus, reducing the R number, which we're all familiar with now, versus the wider societal impacts, and indeed also the economic impacts. And it has decided to prioritise the education of children. We'll remember, however, when the R number was at a significantly high level and increasing, the executive did take the difficult decision to extend the school holiday by an additional week, and that did significantly help in getting the R number down below 1, and we estimate now, looking back on that, probably to about 0.8.
So is that something that you could potentially be recommending, with the early closure of schools?
Well, I mean, we put a range of options to minister, and it's for ministers to determine what ultimate decision that they make. Ministers have been very clear about the importance of education. I, as Chief Medical Officer, am very clear that education of our children is important. Children depend on education for career opportunities and life opportunities, and we know that one of the things that determines individuals' longer-term health and well-being is their educational attainment and all that goes with that. So I think we need to be just very cautious that what we don't do is we take some of the immediate steps to control the virus at the expense of the longer-term harm that can be caused by some of the right steps, immediate right steps, but that actually cause greater harm in the medium to longer term. And that's really, really important. It's a hard balance to keep, and these are difficult decisions for executive ministers.
Well, sticking with the restrictions again for this question, all areas of society have obviously been hit by the virus, and throughout the different restrictions we've had this year, bars, pubs and restaurants are among those that have been particularly hard hit. I know you can't predict what the executive will decide in 2 weeks' time, but as someone who's advising them, how likely do you think it is that they will reopen before Christmas, and what advice will you be giving?
Well, the advice that I'd like to communicate now to all of us, let's make these next 2 weeks work. And that's down to all of us. Let's follow the executive advice about staying at home and only leaving home for essential work purposes, for education or healthcare reasons. Let's reduce our contacts. Let's keep our distance, wear face coverings, and let's make this 2 weeks work. The lower we can get R in this 2 week period, the safer we're all going to be over the Christmas period in terms of any relaxations. The lower that we get R during this period, the less likely there will be need for further restrictions this side of Christmas. This has been a deeply damaging time for many in hospitality and in the business sector, and I think that it is important that they have paid a high price, and I think it is important that we work with the sector to ensure that they can open before Christmas. It will not be without risk, but it is incumbent upon us all to work to ensure that we manage that risk as best we can. So
you would think that we will then be potentially reopening before Christmas the hospitality sector?
If we all work hard and we all make the most of the 2 weeks, wider restrictions, then I think that's a realistic possibility. We cannot keep hospitality sector closed indefinitely. It is just not sustainable for us to do so, and we know the huge impact that's having, not just in terms of from an economic point of view, but actually in the stress and levels of anxiety that's working in the sector, the risk to longer term employment and all that goes with that. So what we need to do is make the next 2 weeks count. We can get this virus back down to low levels so that we can get through Christmas. We take the pressure off our health service. We avoid the need for further restrictions this side of Christmas, and so that we can say to the sector that you can open as is intended on 2 weeks from this Friday. And that, I think, is probably what that sector wants to hear, and certainly that's, I think, what we all now want to see happen. And it's important that we make sure that we create the circumstances that will allow that to happen.
Okay, I want to talk about case numbers here. Over the past few days, looking at the number of cases being reported, they do appear to be falling. Yesterday, there was 280 new cases confirmed. Today, there were only 79 new cases confirmed, which is quite a drop in just one day. The first thing I wanted to ask is that number accurate? The Department of Health tweeted to say there may be an issue with the data being reported today.
Yeah, and I don't think that's an accurate number. I think we've had this experienced this on at least one occasion before, where there has been a delay in the uploading of the results data, and I think that is the most likely explanation of that today. So I suspect what we will see is within the next 24 hours we will see those numbers increase. I think that's an artificially low number.
Well, even taking the figures from Monday, ignoring today's figures, there was a drop there. Cases do seem to be falling. Earlier today, you were talking about the R number, which is, of course, the way of rating the virus's ability to spread. So anything below 1 means not enough new people are being infected to sustain the outbreak. The R number seems to be falling too. With all this in mind, Jenna has asked, why enforce stricter measures if the current ones have already worked?
Well, what we're seeing, and Jenna, thank you for your question, what we're seeing is that the virus is sort of in equilibrium at the moment. It's no longer declining, and what we're likely to see, and certainly what the modelling would suggest, is that we're likely to see an increase in transmission, increase in cases, increase in admissions into hospital and into ICU had the current restrictions ended. So we have modelled that through. And insofar as one can be confident with modelling, because they are not predictions of the future, that demonstrated that the hospital system would have been overwhelmed in and around mid to late December. It would not have allowed us to get through to the other side of Christmas. So in light of that modelling data and the discussions around that, the executive took the difficult decision to extend and indeed go further in terms of the restrictions over the next 2 weeks, so that we could reduce the case numbers. Don't forget, we'd be starting from a relatively lower baseline, because as you say, the R number is in and around 1, but we need to get it lower than 1. And obviously, the lower we get it and the longer we can keep it below 1, then the greater the impact that we're going to have.
And what about these new Christmas measures that were announced today? How are you expecting them to impact case numbers and the R number, this 5-day period where social bubbles or household bubbles can be made bigger?
Well, obviously the executive has just announced that, and indeed the 4 UK nations have just confirmed those arrangements. Now, this is advisory to individuals, and people will need to make up their own minds about this, because we need to bear in mind that any occasion where we come together, where there's more mixing, and particularly where that mixing is indoors, there's increased risk. This virus doesn't go away for Christmas, it's still there. So it is likely that any relaxation will result in increased cases, increased admissions, and increased admissions into intensive care. And for some people, unfortunately and tragically, the outcome may not be a good outcome. However, we need to balance all of that with recognising this is a very important time of year. We need to balance that with recognising it's been a very difficult year for many people. We have spent many months of that separated from each other, separated from family and friends. So it's important that we recognise that people will come together irrespective of the advice that we give, and it's important that therefore we give advice to the population to ensure that they can come together in as safe a way as possible, but recognising that there is risk, and we will see increased cases after the Christmas period. There's no doubt about that.
Well, off the back of these new Christmas restrictions, should we be expecting another lockdown in January? Is that something that could be coming then?
I think that is a possibility, but I don't think it's a certainty. It really depends on all of us. I mean, it depends on our behaviours. I've said, and the Minister has said repeatedly, the power is in all our hands. This virus doesn't spread itself, we spread it. Now, what goes against us at this time is the time of year. This is undoubtedly a seasonal virus to some extent, and it's colder, there's less sunlight, and we know the virus doesn't likes cold temperatures, and it likes lack of sunlight, and there's more of us coming together at this time of year indoors because it's colder. So the virus spreads much more efficiently. So that's against us at this time of year. But it really depends on all of us following the guidance that we all know well, now I won't repeat, and also how much we adhere to the guidance over the Christmas period, because we can make a real difference in terms of what the new year looks like. And if it can't be a normal Christmas, but there are steps we can all take to keep each other safe and ensure what we don't do is end up tipping our health service into a very difficult situation in the new year.
So what do you expect to happen following the 27th of December? We come out of this 5 days of relaxed restrictions. Could we be going straight into a lockdown off the back of that, or do you think there'll be some sort of delay?
Well, I think it'd be unwise to use the word relaxed about this period, because there's nothing relaxed about the guidance and the advice that we're providing. This is about trying to minimise risk, and what we need to do is take as much risk out of Christmas as we can, but at the same time recognise it's important that we all get the benefit from Christmas that every one of us needs. We need to remember that there are older people and those who are clinically extremely vulnerable who will remain at risk. They are no less risk from this virus at the Christmas period than they were at any other period. So it can't be a normal Christmas, but we can have some semblance of a Christmas if we all follow the advice. In terms of how soon thereafter, we know there's always a lag between increased contact, us coming together, any relaxations, and thus that working its way into cases. So we might anticipate that after a week, 2 weeks, we may begin to see an increase in cases. Then that takes a further week for it to work its way through into hospital admissions, and a further 2 weeks then to work through into intensive care. So After the Christmas period, you can anticipate, between a 2 and a 4 week period, lag period, you will begin to see the impacts of that Christmas. So we can't have a blowout at Christmas. This cannot be a normal Christmas. We have to be really, really careful to protect each other and protect those who are particularly vulnerable, and also protect our health service, because what we can't do, and what none of us wants, is to be in a very difficult situation, which we can't rule out, of advising the executive that a further period of restrictions is required in the new year. So let's work hard over the next 2 weeks. Let's all come together. Let's make this work. It's going to be a painful 2 weeks for many and for all of us. So let's get the maximum gain for that. Let's go into Christmas with the transmission of this virus as low as we possibly can make it in Northern Ireland. And that is how we will get a safer Christmas, less outbreaks in our care homes, less outbreaks in our hospitals, less people in hospital, more people at home, and we can all interact in a safer way because the virus is not as widespread.
In relation to hospitals and hospital beds, we've had this question sent in, Dr. McBride. It asks, how do the current numbers of free hospital beds and intensive care beds compare to this time last year?
I don't have those exact figures, but I know from looking at some of the figures over the last couple of days, a number of our hospitals have been running at over capacity, over 100% capacity. And in terms of some of the pressures on intensive care, those have settled a little bit, but indeed have remained extremely high and worryingly high in the last couple of weeks. But I think that what we need to bear in mind is that we are only managing to get through this period at the minute by significantly downturning other care. This concept that somehow or other that there's endless capacity in the health service is just not true. It isn't about beds and it isn't about ventilators, it's about skilled staff. It's about those doctors, those nurses, those anaesthetists, those respiratory technicians. It's the skilled individuals that support people who are very sick with COVID. We're running 2 health services at the moment. We're running a health service for patients with COVID, and we're trying to maintain normal health services as well.
But
we're actually providing 73% more activity in this wave of the coronavirus, despite the fact that we're seeing more pressure from COVID in our hospitals than we did in the first wave. So what we've had to do is actually downturn complex surgery, elective surgery, and indeed, sadly, postpone some cancer surgery. Now, that is not a place that any health professional or any manager wants to be. So we really need to ensure that we press down on the transmission of this virus so we can provide the health service that we all need and stop delaying people for getting access to the treatment that they need.
Well, you're talking there about other kind of treatments that people are looking for, and I know the importance of looking after your mental health during the pandemic is something that you value, Dr. McBride, and you've talked about it in the past few days. There's lots of people getting in touch about this topic specifically. Carla, she's got in touch. She says she recognises the seriousness of COVID-19, but wants to know what's being done to help people maintain good mental health during the pandemic. She says she feels like it's taken a backseat somewhat in decisions that have been made recently.
Well, Carla, thank you for your question, and I think it's a really, really important issue, and it's an issue which I'm really concerned about. I think that we can all see the immediate impacts of COVID in terms of people have been in the cases and people have been admitted to hospitals, and we hear tragically of the people who have died, and we hear of the syndrome of long COVID and people who have otherwise been fit and healthy, younger people who are dealing with the long-term consequences of this virus, which we know still are learning about. But there's no doubt that there are some hidden harms from this virus. There are the hidden harms we just discussed about people not getting the treatment that they, in a timely way, that they otherwise would do. But also there's the hidden harms on all of our mental health and well-being, and that's every one of us. We're all affected by this. On the normal support mechanisms that we all relied on, contacts with friends and with family, those are not there to the same extent as they were before. But there are a couple of things I would say. It's important that we talk to each other about how we feel. It's to talk to families and friends. It's important that we do the things, the 5 steps that are important for all our mental health and well-being, that stay connected. We take regular exercise, we eat well, we sleep well, we do all of those things. And that what we have done is put a whole raft of services online, apps, advice, which are accessible to the public. We've provided counselling support, mentoring services online. We have published a specific mental health COVID action plan. The Minister has launched the Mental Health Action Plan with a range of very specific actions within that. So we have redoubled all our efforts in terms of ensuring that we're doing all we can to safeguard the mental health and well-being of the population. But yes, I too am significantly concerned about the toll that that's going to take in the medium and long term. We're already seeing the pressures on mental health services. Not just here, but right across the UK. We know the impact that it's had in terms of consumption of alcohol, and we know the direct harms and the hidden harms of alcohol consumption. So I think that the legacy of COVID, apart from the lives lost and the livelihoods that have been impacted upon, will be those longer term consequences that we're going to have to deal with for quite some time.
And do we have the resources in place, Dr. McBride, to be dealing with those consequences?
Well, I mean, the resources within the health service, is a discussion in itself, and we could spend all evening talking about it. I think it's well known to all of us that we have not had the resources within healthcare for many, many years to deliver the quality, timeliness of care that we would have wished, and that's why we have some of the worst waiting times, the worst waiting times in the United Kingdom, and those diminish all of us. So the issue about resourcing the health service is a very, very fundamental issue. We know the staff vacancies that we have across the system. Those have added to the pressures on the health service at this time. And again, it would be remiss of me not to commend all those health and care workers in the front line. I think it's deeply humbling to know what they have been doing day and daily on our behalf, day and night, not just in the first wave, but in the second wave, not just in terms of providing care for COVID patients, but actually trying to rebuild our health service and trying to get those people who have treatments been delayed back on track before this next wave of the virus hit.
Well, exercise is something that a lot of people it's something that helps a lot of people keep a healthy mind. Darren has got in touch. He asks, why are children, young people and others being stopped from playing sports?
Well, I mean, I think that's a good question. I mean, exercise, and I mean, again, you could ask the same question about gyms. Certainly, we know that we kept gyms open previously, and our executives now agreed to close gyms for a 2-week period. We have had in Northern Ireland a number of outbreaks and some sizable outbreaks associated with gyms, despite all the best efforts of those using them and gym owners. And it is for a 2-week period. Equally, we did put in place restrictions in and around physical exercise in schools for a period. Those have now been removed, because we do realise how important it is for every one of us for our mental health and well-being, irrespective of what age we are. Whether you're 9 years of age or 90 years of age, it's important that we get physical activity, and that's why during this phase we haven't said to those who are extremely clinically vulnerable, we haven't said to them, go back and shield and stay in your house and don't come out, because we realised from surveys and research that we did here in Northern Ireland that 40% of those people, older people, those who were shielding, were suffering from problems with their mental health and well-being and loneliness. So that's why we've taken a more measured and balanced approach. But even during this 2-week period, I would just encourage people to take physical activity, take exercise. It's really important. Yes, by all means, adhere to the guidance in relation to numbers of us coming together outdoors, but do please take physical activity because it's important not just for our physical health, but also for our mental health.
Well, just quickly on the topic of vaccines, we've obviously heard a lot of positive news about them recently. A lot of people feeling quite optimistic about them. Kurt is asking what planning is in place regarding large-scale distribution of COVID-19 vaccines in Northern Ireland, considering approval may be only a few weeks away.
Well, we've been, probably, Kurt, thank you for the question. I think we'll be seeing further details of that over the coming days and weeks. We've been planning for the distribution administration of the COVID-19 vaccine for many, many months. There are very detailed plans in place, obviously until such times as the details of the specific vaccines became available to us. There's still some refinement that we need to do. We are actively recruiting vaccinators. We have a range of delivery models ranging from mass vaccination sites, some of the approaches that you saw for the recent flu campaign, through to mobile units, to roving units, with detailed plans in terms of how we would vaccinate the vulnerable in our care homes and do so safely. And there are some logistical differences and challenges with some of the vaccines. Some of the vaccines you've heard about in the news, in terms
of the delivery of the vaccine, how will that be played out? Who will be involved? Will the army be involved?
Well, from a logistical point of view, we'll take logistical support from all that we can. I don't think that we will need boots on the ground or army on the ground to administer the vaccine. We have 800 peer vaccinators within our trusts. We're recruiting a cadre of volunteers for those who wish to do the online training and become vaccinators. We have retired doctors, dentists, nurses, a range of other individuals who have volunteered. I think last we looked at 600 volunteers, and there's some 72 hours since we put up the online web address for people to volunteer. 400 or something of those already been accepted, have gone through the first phase of the training. So we have a very well coordinated and thoughtful planned approach to the rollout of this vaccine. In terms of how this will be made available, we anticipate we will be getting some supplies of the vaccine this side of Christmas. We anticipate we will be beginning to vaccinate this side of Christmas, depending on obviously the regulator approving the vaccine and the vaccine being available in sufficient supplies. We will not, however, see the vaccine begin to have a significant impact in terms of the reduced need for some of the restrictions that we currently need until I would have thought the springtime, because it's only then we will have sufficient numbers of the vulnerable people isolated that we can begin then to ensure that the pressures on our health service are reduced, and also the risk to those people who are most at risk is reduced. So I think we are hopefully at the beginning of the end of this. I think by the summer we will be in a very, very different place, but it is crucially dependent on that vaccine being approved, crucially dependent on the supply of the vaccine, but most importantly of all, it's important that we all take up the offer of the vaccine when actually it's made available to us.
Well, just before we go, Dr. McBride, there's one last thing. The pandemic is something that none of us expected or anticipated, and all aspects of our lives have changed in some way or another. The last thing I want to ask is, how have the past few months been for you? How have you found them?
No one has actually asked me that before, Jordan. I think that, I've been Chief Medical Officer for 14 years. This is the second pandemic that I have experience of. The last one was in 2009-10 when we had the H1N1 pandemic, swine flu. I don't think that I'm any different from any other member of the public, that I've never experienced anything like this ever before, either in my professional career as a doctor, as Chief Medical Officer, or indeed in my personal life. I think the challenges, it's a much overused word with this pandemic, but it has been unprecedented. It has been demands of our health service, which have been profound, and it's been deeply humbling and a privilege to see the commitment from staff on the front line. All our key workers, whether working in retail or elsewhere, it has been deeply humbling to see the response from the public as well, in terms of working to keep everyone safe and the sacrifices that everyone has made. And at a personal level, yes, it has been extremely challenging as well. And again, in that respect, I'm no different from anyone else. We're all not seeing family and friends as we would wish to. And all I would say to your listeners and viewers is there's hope. I think we are now beginning to see the beginning of the end of this. But what we cannot do is drop our guard now. We have a challenging next few months to get through. We all need to dig deep and hunker down and get through this. And I just ask you to make the most of this next 2 weeks. The vaccines are coming, and they will start to do the heavy lifting by the spring, and hopefully by the summer, talk of restrictions will be a thing of the past.
Dr. McBride, that's a positive note to finish on, so I think we'll leave it at that. But thanks very much for coming on. We really appreciate you taking the time to come on tonight and answer those questions. Thank you to everybody who got in touch. We didn't have time to get back to all of you, but hopefully the areas we've covered have touched somewhat on what you were wanting to know. Don't forget, you can keep up to date with all the latest developments on the BBC News NI website, which you'll find at bbc.co.uk/newsni. And if you want to watch this programme back again, you can do that on the BBC News NI website or on the BBC iPlayer. We'll be back again next week with another coronavirus catch-up, but until then, stay safe.